This morning, we executed Operation Never Say Die. Federal agents from multiple agencies descended on fraudsters throughout Southern California, executing multiple arrests and search warrants. We arrested 8 defendants, including medical providers such as nurses and doctors. We are announcing charges against 15 separate individuals who engaged in healthcare fraud, resulting in losses close to $60 million. The individuals targeted this morning were committing a variety of healthcare frauds in the greater Los Angeles County area. Medicare reimbursed these companies for services that were intended to go to patients dying from a terminal illness. Instead, as the complaints and the indictments charged in what's been unsealed today, these defendants recruited beneficiaries who were not terminally ill and paid them to pose as patients receiving hospice care. Medicare then paid millions of dollars, hundreds of millions of dollars, on false and fraudulent claims submitted by fraudsters. This happens often way too much. For example, let's talk about one of the defendants that was arrested this morning, Lolita Menard, a 65-year-old woman in Anaheim. She ran a company named Topanga Hospice Care. She billed Medicare for more than $9.1 million over a 5-year period for the care of supposedly terminally ill patients. This company had a death discharge rate of 85%. When you go to hospice, you're usually going there to die. You're not supposed to have an 85 survival rate coming out of your hospice facility. That is 5 times more than the national average of 17%. One of the beneficiaries are the people whose names are being listed as the patients at the hospice. One of the beneficiary couples we spoke to said that she approached them at a market, or that they were approached at a grocery store about signing up for her hospice care. Menard and 3 other Topanga employees visited these individuals at their home and promised them if they signed up, everything would be free and that they would each receive $300 in cash per month. The money was delivered in an envelope, again in cash, so this couple got $600 a month to allow her to use their names on these fraudulent invoices that are then sent over to Medicare. Search warrant was actually executed in 2022, but nothing happened with these cases. Nothing's happened with fraud under the prior administration. And you'll have to ask them why, but presumably it just wasn't a priority. And so we are making fraud a priority. So quickly, within the last year, we've been working at lightning speed to put these cases together, and you're seeing the fruits of that today. And I think you'll be seeing many more of these operations in the months ahead.